we are Adric. My name's Alia.
My name's Leon.
My name's B.
And we go to Brigham Middle College. Our 17 goals, our NGN goals are 17 and 5, and we're trying to integrate AI into healthcare and healthcare rights. We ask the role of the judges to be investors, social entrepreneurs, medical officials, and trying to solve for STEM solutions.
The problem we are addressing the current unprecedented public health crisis of COVID-19 and its rapid spread around the world. How can we lessen the peak by decreasing exposure to the patients with the virus?
Agent users are expected to be all civilians who are worried about exposure to those infected. Doctors will be the output and receive digital medical notes. I value all human safety and health as top priority.
Our application is an advancement to pre-existing technology and does not require immense funding. In fact, ADRIC is just a simple application on mobile phones, and it only requires simple funding and simple development, and we can impact over 70% of civilians.
We are AI doctors for safe disease detection.
ADRIC is an easy-to-use application that allows millions to stay at home instead of crowding hospitals and increasing the rate of exposure.
Because we take advantage of social impact through the proliferation of mass technology, which has proven to work in the past, we know you believe in our app.
We ask judges to lead us into the technical advancements and provide lead developers to ensure the quality of our app.
Why we are needed. Hospitals are dense and overcrowded with patients, doctors, practitioners, nurses, and etc. COVID-19 isn't the only issues doctors are having to juggle. They are having to juggle the surge of cases as well as ordinary accidents and surgeries.
In order to relieve stress from both doctors who lack PPE and organized medical database, as well as citizens who are afraid of being exposed to the virus.
The 7 steps to safety. Patients download app, fill out the representing medical, hospital, or doctor. The user can take a quick picture.
AI feature will detect symptoms through face scan, such as fever, temperature, BPM. Designated doctor or hospital receive notes in their medical database.
The app will filter users into 2 groups of for the doctors. 1, users with 70% matching symptoms of COVID-19, or 2, users who score less than 70% are noted to be healthy. Only then are possible carriers of COVID-19 allowed to enter the hospitals.
So can I suggest something so that I think the audio is not that good. So why don't you just mute the audio and then you guys explain? Is that okay? Because we cannot hear your audio properly. That happens when you try to run YouTube through Zoom. I don't know, sometimes it's not working good. So can you just run the video and then you guys speak? Is that okay? We cannot hear you. Can you unmute yourself?
Oh, can you not hear the video?
No. So I mean, no, we cannot. We can see, but we cannot hear the audio. So I think that's the best thing, that you may want to rerun it and just run the video and then you guys speak.
Is this good? Wait, what do we have to do?
Just explain what we're seeing. Just let it run without sound and just tell us what we're seeing of the user experience.
All right, so this is how the app looks like when you first see it. You'll be welcomed. And the first thing you'll have to do is fill out basically a form. And the most important part is the designated hospital place, because once everything you do, all the analytics will go straight to your doctor and your hospital. So after that, you go to home and you can see cases that are in your area as well as your BPM and the analytics such as your flu rate, the fever rate, and then other symptoms that are usually on COVID-19 cases. Once you're from home, you can go to ADRIC, and then ADRIC will just take a face scan, a simple picture, and once you go to that, you can go to your profile, and that very picture will put up like recent analytics. You can see your current temperature, which can also show your fever rate, and it has been proven in the past to work. It'll also show general information. All of this information will go to your designated hospital. We are ADRIC, the AI doctors for safe disease detection. And that's the end of the presentation.
Great, thank you for the present. I have a couple of follow-up questions. I think this is a common theme here, primarily because like as a patient, you're actually like generating some information and you're saying like, hey, we're gonna actually like pass it over to the hospitals. have you thought about like how you're gonna do it while actually maintaining the security and privacy of the doctor?
Yeah.
Sorry, privacy and what we call security of the person who is actually like submitting the information.
Yeah, so basically we're going to be using blockchain because blockchain has a lot of security advancements, and it has been evolving since COVID-19 has struck. So we're going to be using different types of technology to secure both the profile of the citizen and also when the note goes to the doctor. We hear that medical notes and the doctor's database during COVID-19 has been hacked, it has been deleted, and some of them also have just paper, and that can get lost and deleted and ruined.
Tell me your favorite feature of this app, and if there was one thing that you could change, what would it be?
Yeah, what would it be?
My favorite feature is the simplicity of this app, and if I could change something, I would change how it just looks like overall.
Yeah, I feel like the technology that we've been using, or at least the prototype advancement that we've been using, it hasn't shown the great depth that our app can do. So being able to sort of have better quality, something easier to use, would be amazing.
And you mentioned additional diseases. Is there another disease you want to share that it could be relevant to?
Yeah, it could be also relevant to the flu.
Cancer?
Yeah, we've also heard a lot about cancer and being able to see those symptoms. So once we can sort of break into the field of COVID-19, and if it is successful, then we could probably go into the fields of cancer and then the flu, and just for everyday life, even after the virus is over.
Well, thank you for that explanation and for your presentation.
Of course, thank you.
Thanks. I just had this is Samina here, just one quick question. Have you done any market research in other apps that are out there, other technologies that are out there with similar services? And how does yours compare? Like, why is yours unique?
Yeah, so we actually did some research on the face scan, and apparently there was someone who, I think it was about in 2017 when the gun control pandemic or the public health crisis was in the heat. And so they actually launched a way where they could use thermal technology to find weapons that were already, in the area. So they did that for Corona. But the only thing that was different was they didn't have a technology or an application where any user could use it. It was only available to the government and in public areas and cameras. So our application works differently because we have an application for both doctors and any other civilians.
Yeah, I think one of the big assumptions that you're making is the fact that like all of this would work if everybody has an app. And the biggest challenge will be like, well, getting everybody to have the app.
Yeah, so basically I worked with CBT at Harvard, and before we had research, but we didn't have content or marketing. So I feel like the best way to really sort of get that information and get more citizens to be active in it is just to start with a test group, an experimental group, maybe a small community, even start with a small household, like our own family. And then we can start grow from there.